Climate is not weather. Weather is a particular daily meteorological condition. Climate is the average weather, measured over a course of long period, from months to millions of years. But climate is changing. Sea level is rising. Ice sheets are shrinking. Extreme floods are seen. On the other hand, desertification and extreme lack of water are widely noticed. Extreme weather conditions and number of hurricanes are on rise. Dust storms are attacking more areas. Our planet temperature increased by average of 0.76 Celsius over the past century. Dangerous heat waves attack many areas, while extreme cold weather is seen in other areas. So, what causes climate change anyway? Our atmosphere is extremely important. It helps distribute temperature and moisture through the globe. Some gases have the ability to retain heat. They are called greenhouse gases. The more gases we introduce to the atmosphere, the hotter our climate becomes. Think of them as throwing an extra blanket on your bed. The main greenhouse gases of concern are carbon dioxide, methane, water vapor, ground-level ozone, nitrous oxide, N2O, and CFCs. It is estimated that almost 80% of the world's CO2 production and 20% CH4 production comes from burning fossil fuels. Global energy production is perhaps the biggest producer of greenhouse gases. Transportation, industrial, and agricultural sectors are major contributors too. Climate change affects all aspects of our life: economy, politics, and human health. The respiratory system will probably be one of the most vulnerable systems. Asthma attacks may intensify due to air pollution, pollen, and dust. People with allergic reactions will be particularly vulnerable, especially children and elderly people. Harmful ozone concentrations will also increase at ground level. Food and waterborne diseases will intensify. These are diseases caused by pathogenic microorganisms that can be transmitted by water or food. These can cause diseases such as cholera or dysentery. Diseases that can be transmitted by insects, flies, or ticks, such as malaria, are called vector-borne diseases. These are climate sensitive. They may increase due to lack of proper sanitation or flooding in some regions. These insects, and due to climate change, will breed in areas which are not their natural habitats. For example, malaria could spread again. Extreme weather events and changes in temperature and precipitation can damage or destroy crops or interrupt the transportation of food, thus creating a major health concern of lack of proper nutrition. High temperature is another health concern, since that may cause heat-related illnesses, which can range from heat cramps to heat exhaustion to more serious heat strokes. Exposure of people in their workplace and homes to the extreme events is also a health concern. Outdoor exposure to UV radiation, heat and dust will increase, and indoor exposure, especially in chemical industries, will also pose greater health risks. Climate change is bad, yet its effects can be mitigated by reducing our energy consumption. Burn less fossil fuels, produce less gases, drive less in your car, and carpool. Use public transportation. Be smarter in your choice. Our region is not a major producer for greenhouse gases like other industrialized regions. Therefore, there is a need to focus more on adaptation measures, establishing an early warning system to notify people of potential hazards, raising awareness through including the climate change concepts in education. Water should be properly harvested and conserved. Do not abuse water resources. Encourage safe use of reclaimed water in agriculture. All this will help our health and the health of our planet.